All right.
Mm-hmm.
Okay. Well, good afternoon, everyone. Welcome to open enrollment round 2. We're glad that you're here. It's always important to learn a little bit more about your benefits and how you can utilize your plans effectively and save some dollars in your own pocketbook. So we appreciate you being here. It also helps you as you're using your plans throughout the year, excuse me, to utilize them to the best of your advantage, help so claims aren't going to any kind of collections or anything else. So we appreciate your time and thank you for being with us. My name is Kim from Lee Carpenter Kemp's Insurance. And as a reminder, Jessica's not here right now, but I was going to have her pop in because I know some of you call in for some assistance sometimes or email. And usually that's going to Jessica, who's my account manager, and she handles your account as well. But next time I'll make sure. I know she's going to be going out with me out to the waste management sites as well. So all those people will be able to actually put a face to the name there. But anytime, if you need anything regarding your employee benefits that we cover, please call us at Lee Carpenter Kemp's Insurance or send us an email. We want to help you 24/7. So around the clock or throughout the year, if you have any questions about how your plan works, if you have a claim, you're not sure, do I pay this or not pay it? I'm having a new baby. When can I add my baby? All of those good things are questions and things that we can help you with. Okay, so don't be afraid to pick up that phone call and give us a call. So open enrollment will be starting on the Monday, November 29th. Everyone will have access to your EASE employee online portal. And again, your own personal portal is personal to you with your dependent names, all of your information's on there, the plans that you're currently enrolled in. If somebody's waived off, it will show you all of that information. So once again, as you go into your portal, whether or not you want to make any changes for January 1st, 2022, we still need you to go into the portal and just make sure you're reselecting your plan. If everything's the same, you can just keep going through the next page, through the next page, and through the next page there until you get to the 2 signatures. Once you complete the 2 signature pages, then you get that congratulations, you're complete. And that's what we'll need to do. We're going to open up that enrollment on Monday, November 29th, and then we'll close it on, I believe it's Saturday. Yeah, Saturday, December 11th. That should give everyone plenty of time to go in and look at we have a few minor changes, not many big ones this year again, but it'll give you time to get in, go home, be with your spouse or your family to make decisions that are going to work best for you for the next 12 months, because all changes will be effective January 1st for the following 12 months. During open enrollment, you can change medical plans, change vision plans, you can change the dental plan as well if you want to go from the PPO to the HMO, and we'll talk about that in a few minutes. So now's the time to make any changes that way in your plan designs and your selections. You can add or delete any dependents that you need to put on or take off now. And and then you can change between carriers as well, because we're going to add Kaiser to the medical plan options this year for January. But you can only select Kaiser if you live in a Kaiser service area. So that will be pretty much Turlock North, Bay Area, Sacramento area, or if you're Madera South through Fresno in that area as well. We do have a handful of employees that are eligible for Kaiser, so we wanted to put that benefit in there if you want to switch off the Blue Shield plan onto the Kaiser plan. So that will be the employee's option. So when you go into your EASE, I know Christina sent out a 1-page paper. When we open up the portal, you'll get an email. As long as we have your email address on file on EASE, you'll get an email that the portal is now open, and it'll have a link on there for you to click on to go right into the program, so you don't have to type in the URL code or anything else. Your login is your email address, or if you didn't have an email listed in there, it would be your first initial and your last name, no spaces, all lowercase. And then your password, you created your own password the first time or the second or the third time you went into EASE. If you don't remember your password, then you can click on the forgot password and it'll send you a temporary password to your email address. If you don't have access to that, then you can call our office as well, and we can reset your password for you and send that to you so you can get online and look at your benefits information. As a reminder, it is open enrollment time. So now's the time to make those changes. If you want to jump from one Blue Shield plan to the other or vice versa. If you want to add a spouse that maybe you left off this year, now you want to add that spouse, or you got married 6 months ago, you never added your spouse, now you want to add them on. Now's the time to do that, because the decision that you're going to make for January 1st is going to be set for the next 12 months. And the only way you can make changes then is adding or deleting dependents throughout the plan year if you have a major life event. So that's a marriage, a divorce, birth of a child. If a child turns 26 and they're on one or all of your plans, then they'll come off. Overage children, once they turn 26, they can be married. They could live in Alaska and still be on your medical plan. Alaska is not a very good place though, because they only have one health plan. So that was a bad summary there, but your child doesn't have to live with you to be on your plan is what I'm saying. And they could actually potentially be married as well, but so keep that in mind. So during the plan year, once we roll into January and into 2022, if you have that marriage, divorce, overage child, and you want to look at other coverage for that child, we can help you with that. If you have a baby, you want to make sure any changes that are happening, you're making sure that you add that baby on, or you add your spouse on within 30 days of the date of the event. Now, when someone has a baby, the health plans changed back in the Obama days in 2015, that anytime a baby is born, it's automatically enrolled on the mother's plan for the first 30 days. So people always feel, oh, great, my babies are automatically on. And for you guys, if you're on that base Blue Shield plan, you're not paying any premium because your employer's paying all that premium. So you think, oh, my baby's on the plan, I'm good to go. Well, after 30 days, if you haven't physically gone back into the EASE program to put in your baby's name, date of birth, Social Security number, if you have it, if you don't have it yet, which happens quite often, then once you do get it, you can go back into EASE and put that on there. And that will submit that enrollment to the health plan or the dental plan or the vision, whoever you're enrolling that child on. So make sure once a baby is born that you're getting that baby, you're going into EASE and you're adding that child on to your dependent status, and then going through all of the plan screens to make sure that baby is added to whatever coverage you wanted on there. Otherwise, if you go outside that 30 days, then you may have to wait more than likely till the next open enrollment time, which would be the following January of 2023. Okay. All right. So for this year, we've got a few minor changes, nothing too drastic, but a few new exciting things as well for you all. We're still going to maintain the two Blue Shield PPO, Preferred Provider Organization plans that you've had for the last several years. The base plan that MCAG pays 100% of for yourself and your family will remain the same with a $250 deductible. Same copays. Out-of-pocket maximum on that plan is $4,300 per person, or maximum 2 per family. So if someone had some hospitalizations, some catastrophic claims, everything else, the most your financial responsibility is for one person is $4,300. If you had more than one person in your family that had some larger claims, the most a family paid would be double that amount, and that would be $8,600. So that's your financial out-of-pocket cost. On the base plan, again, it's at PPO. Both of the Blue Shield plans are PPO plans, so you can get the best benefit when you use a Blue Shield PPO contracted provider. And you can find that if you're using a new doctor, you can call their office and ask, are you contracted with Blue Shield PPO? You always want to make sure, are you contracted? Because there are out-of-network benefits. So if they're not contracted and you just call and you say, Dr. Joe, do you take Blue Shield PPO? Yes, we do. Well, then after you visit, then you get this big bill because they're out of network. Your deductible goes way up, and the plan only pays 50% after that deductible. So your benefits really get watered down and you pay a lot more out of your pocket. In California, it's pretty hard to find a provider that's not contracted with Blue Shield, but it certainly can happen. And then anywhere in the United States, if you're out of the California, or even if you're in Southern California and you're not feeling well, or you need to go to emergency room or urgent care, you can call the number on your ID card and they'll locate a local provider for you to use that's in network. You can go online, look up blueshieldca.com. A lot of this information is available on your EASE program as well. So if you just go back in and log into your EASE program, go to Blue Shield and into documents on that, and it will have a lot of that direct links to their websites and things and phone numbers for you to access when you're out about and traveling around. So the base plan is really no changes for the next year. You also have the buy-up plan like you've had previously, and we do have some people that pay the additional premium to buy up to the richer plan. The Blue Shield Platinum Full has a $0 deductible on that plan and a $10 copay. So your out-of-pocket expenses are a little bit less. However, I do want you to note that if you're considering, or if you want to maintain that buy-up plan, think about, what are my expenses going to be next year? Do I know if I'm going to have am I going to have a large expense on my medical? Am I expecting surgery? You know, I got to have my hip replaced or my shoulder surgery done or something. That buy-up plan this year actually has a higher out-of-pocket maximum, which is $4,500. Again, 2 per family. So if you have a spouse or children, or, you know, more than one person on that plan, it's always double that. So there's no deductible, but a family could potentially spend $9,000 out of their pocket financially between January and the end of December on that. So I just want to give you that information so you can kind of take a look as you're looking at both plans. Is it worth you to buy up to that little bit richer plan? What are the reasons you might want to buy up? Do I just don't want to pay $250 the first time I go get an outpatient surgery or an MRI or go to the hospital? Then that's certainly your option there as well. But that out-of-pocket maximum is a little bit higher than the base plan too. So PPOs, you can go in network, you can go out of network. You have all the tertiary facilities, Stanford, UC Davis, UCSF in California, Mayo Clinic, they're all in network with Blue Shield. And again, if you're out of the area, or if you're in an emergency with any health plan, life-threatening, you can get to the nearest hospital. You don't need to worry about, oh wait, let me call first before you drive me over there because something terrible is really happening. Or if you're in an ambulance, don't worry about where they're taking you, because they're going to take you to the nearest facility or the nearest one that can accept you at that time. And then if you're admitted to a hospital in an emergency that's not contracted with your carrier, whether it's Blue Shield or Kaiser, if someone enrolls on Kaiser, then as soon as you can be transported to one of their contracted facilities, then they'll transport you to that facility. More than likely, it just depends on what's going on at your stay there. Maybe you just have another day, so it's not worth to send you another day to another hospital just for one night, and vice versa, all that kind of stuff. So lots of options for you. Any of the medical plans always cover preventative care 100%. And so I encourage you to get your annual exams, whether it's just a general physical, whether it's a mammogram, colonoscopy, prostate exams, children's immunizations. One thing we've really seen with, COVID these last year and a half, almost 2 years now, is that wellness, staying healthy has really helped a lot of people on surviving COVID as well. So all of the carrier websites have a lot of health information for you. If you want to look that up, smoking cessation, just all kinds of things on how to stay healthy, how to use your health plan, things like that. So I encourage you, if you're not already logged into your health plan as a member, to do that and find out a lot of the perks that they have for you that can help you stay healthy and get into work each day, right? So the other option that they're adding is Kaiser. Oh, and first I forgot to mention in the beginning, when you first go into your EASE portal, it's going to start in the benefits enrollment. for 2022. However, I also want you to go into your profile. So you click on your profile and double check that your address is correct and most certainly your zip code, because only people that can enroll on the Kaiser plan have to live in the Kaiser service area, and that's determined by your home zip code. The Kaiser plan is an HMO, and it is also a rich plan. It has small copays and so on, and the out-of-pocket maximum on that Kaiser plan is $4,500. So we tried to kind of mirror the benefits. We got one of the richest plans that Kaiser has, because you guys have the richest plans that Blue Shield offers as well. So with Kaiser being an HMO, though, you have to stay within the Kaiser system. Unless there's something that a Kaiser provider cannot treat you for, or they need to transfer you to another hospital, then that will all be approved through Kaiser. But again, in an emergency, say you're signed up for Kaiser, you live in Turlock, you have an emergency in Merced, and you need to get to the nearest emergency room, then you go to Mercy Hospital. And that's perfectly fine. But just for general doctor's visits, surgeries, all your other medical stuff, prescriptions, you want to go to Kaiser that way as well, because they are an HMO. They'll have you pick a primary care physician that you can change. You can call and go to another doctor. That's your prerogative. On the Blue Shield plans, you don't have to choose a primary care physician on that plan, but on the Kaiser plan, you will. And if you don't, then they'll choose one for you. And if you go in, because this will be a new doctor for you, if you go on the Kaiser plan, then you want to, I recommend you go in for an annual exam, go in and meet that doctor. Not all people like every single doctor that's out there, and see if that provider is going to work for you. Did they give you time during your visit? Did you feel they had good bedside manner? Did they answer your questions that you liked, and all those good things? So you do have an option to change doctors at any time with Kaiser. You just need to contact them, and they'll change it the first of the following month. The company is going to maintain the $200 spousal surcharge if you're enrolling a spouse on one of the 3 medical plans, and your spouse works outside of the home and they have coverage available, whether or not they enroll on it through their own employer, and you choose to enroll them on your medical plan with MCAG, then they're going to continue that $200 a month surcharge. Christina has that form affidavit that she'll need that refilled out again for the following year to keep everything up and up. And if you didn't already fill that out the past year, or you don't have a spouse on now, but once you do your enrollments in a few weeks, if you put a spouse on there, it's going to ask you the question, does your spouse work and do they have coverage available through their employer? And that'll be a yes or no. And that will then in turn get Christina to send out, well, we'll send out that affidavit if Christina's already off of work then. But we'll want to make sure if you're going to cover a spouse and they have something else available through their employer, that you get that affidavit signed as well on that. The dental plan is the same as what you've had previously with Premier Access. You guys have had that for quite a few years. A few little caveats with Premier Access is you have 3 different network options. You have the exclusive provider organization, the EPO, that pays the highest benefit for your dental work. But the EPO, you have select providers, which would be your Western Dental, the Access Dental on G Street if you live here in Merced. There's one up in Turlock and Modesto as well. And a couple of other local dentist offices are on that EPO. So that's your choice there to get the highest benefit paid on your dental plan. Then you have the middle category, which is a PPO plan. It pays 100% for your preventative, 90% for your basic, and then 60% for your major services, which would be getting a crown, things like that, getting major teeth pulled, like your wisdom teeth and things like that. And then there's a list from Premier Access of your PPO providers. Now that middle benefit section is still a very strong benefit to pay towards your dental work. And Premier Access will pay up to $2,000 a year, January till the end of December, for each member's dental work. If you choosing an EPO provider or the PPO provider. You also have the option to go out of network. So if your dentist is not a contractor provider with Premier Access, you can still use that. They'll pay a little bit less, but you still have that $2,000 a year benefit on that side as well. But you can certainly use a dental office that's not contracted with Premier Access. Some of them will not balance bill you for what your portion was and what Premier Access paid if you're out of network, but some dental offices might balance bill you that extra $20 or $50, depending on what service you had done. If it was a major service, that could cost you more out of your pocket because those are the more expensive type dental services to have there as well. Most people sign up for the PPO side of the dental plan, but they also have an HMO side, and you can flip-flop between both plans each year. Not too many people do it. The only way you can do that is to call Premier Access. It would be on your ID card, or you can look on your ease under the dental and it'll have all that contact information there as well. If you don't have a card, you can switch over to the HMO plan, or if you're on the HMO plan, you want to switch to the PPO side, then you can call and do that. Once you switch to one plan, for you to get back to the other again, you still have to call back. It doesn't automatically go back at January or the following month after you had dental work done or anything else. So anytime you want to switch between the PPO and the HMO on your dental plan, you need to call Premier Access to make that change. Why would someone change back and forth? One of the big reasons is maybe you're on the PPO and you had a lot of dental work done and you've already maxed out that $2,000 benefit and it's only July and you still want to have some more dental work done. You can call Premier Access, switch over to the HMO side, but then you would have to use Western Dental or Access Dental or one of the other few providers and go have the rest of that work done for copays. On your ease, it tells you what all the services copays are. So maybe you need 2 more crowns and you already used up your PPO $2,000 benefit. You can go to the HMO side, go get those crowns put on, and it's an unlimited benefit on the HMO, but you're going to pay that copay amount of whatever that service is. So for a crown, it could be anywhere from $300 to $800 or so, depending on what type of benefit that you're getting there too. So that's really one of the reasons anyone would switch to an HMO, but some people like to have that plan and they don't mind going to Western Dental or Access Dental. And hey, I go in for this service, I'm only going to pay $50 instead of 20% of what my bill is, which would be like on the PPO side there. Your vision plan, again, no changes on your vision. It's still with VSP, and so that's good. VSP has the largest network of providers for vision. You have 2 plan options. You have the base plan that MCAG pays 100% for. That plan has a $20 copay and a $130 frames allowance. So when you go to pick your frames, they'll send you to a shelf. Okay, here's what's covered here. If you want frames over on another shelf that costs a little bit more, then you'll pay the difference of the wholesale price of the $130 of what your benefit pays versus what the cost of the frames are. And on that base plan that the company pays 100% of the premium for you for, that plan is a 12-12-24. So every 12 months, you can get a new eye exam. Every 12 months, you can get new lenses or contacts. And then every 24 months, you can get new frames. Contacts, as a reminder, when you get your contacts, it's a one-time benefit in a calendar year. So when you go to get your contacts, you're going to pay that $20 copay if you didn't have an eye exam. And you want to make sure you get that whole $130 worth at one time, because it's a one-time benefit. So if you said, oh, just give me 2 months of contacts. Okay, they'll give you 2 months of contacts for your copay. But then if you go back in another 2 months, you've already used that benefit. So you've lost out on the maybe 2 or 3 or 4 more months, depending on what type of contacts you use. You may have lost out on that and you'd have to wait till the following year to use that benefit again. The buy-up plan that you have an option, and again on ease, it'll show you the amount per paycheck on what it would cost you and your dependents, if you're enrolling any dependents, to enroll on the buy-up vision plan. Again, it's still with VSP. It's a $20 copay for an exam and lenses or contacts, but they have a $180 frames allowance. So that gives you a little more money to spend for those special frames that you want. $180 versus the base plan is $130 allowance. And the buy-up plan also allows every 12 months you can get new frames. So that's the difference of between the two plans, really, is the allowance for frames and whether or not you're okay getting new frames every 2 years, or you want those, we wear glasses a lot, or I need 2 pairs. You want that every 12 months, you want to be able to go in and get new frames. Then you could go to the buy-up plan.
Kim, we had a question from someone in the group. Alicia, did you want to go ahead and?
I sent it via chat if that helped her better.
I can't really see it. I can just see your name, Alicia, and just a little bit of the line. If you,
sure.
I can't see what it says really. I'm sorry.
I was just wondering, I wanted to better understand the scenario of the contact lenses.
Okay.
Something I have triple coverage for my husband, daughter, and I, but she wears contact lenses now. So I was trying to process what you were saying about, like, to me, it's convenient to say, give me 2 months now. It's going to be the same prescription for a year. So I was trying to process what you were saying about getting it up front and then not.
Okay. So if you're on that base plan, you can get one time, you can get contacts in a calendar year. So if the allowance of what VSP is paying for your contacts would cover 6 or 7 months, it just depends on the type of contacts, because some of them are more expensive than others. Most you can get 6 to 7 months for your copay amount. You want to get that whole entire amount at one time, because your benefit is only paid for one time in the year. So if you said, oh, just give me 2 months worth, you're not using that whole benefit of what VSP would pay for at that one time, but you've also just incurred your own one and only chance to get contacts. Otherwise, you're going to be paying for them for the rest of it. If you have triple coverage, then you've got all kinds of options to do that. Also remembering you can use your Blue Shield card. If you've used your VSP benefit up, you can use your Blue Shield card to get 20% off a lot of vision benefits if you want another pair of glasses or something. So did that make sense? Just if you're picking up contacts, just let the provider know. And most of them are really good at saying, oh, you've got VSP. Okay, this type of contact, you can get 6 months of contacts. And then when you go back in to get your other 6 months of contacts, you've already used up that benefit. You'll still get 20% off the cost, or you can use your Blue Shield benefit as well, however you want to work that out. But it just depends on the type of contacts you're getting and how much you can get at one time. But you always want to get the maximum amount of contacts when you pick up on your benefit, because it's only once a year you can do that.
So I understood, we're clear. You did preface by saying the VSP base plan, that's what we all have if we don't change anything, right?
That's what you have if that's what you're enrolled on right now, correct?
Thank you.
And it'll tell you that when you look on ease, it'll say if you're on that base plan or and it'll show no cost too. So it'll show 000. If you look at the buy-up plan with the higher frames allowance, it'll show you depending on who you might want to cover, and you know how to go in. If you have 4 people in your family, but only 2 wear glasses, you can just click on enroll those 2 and waive the others. But I mean, if you're on that base plan, everything's paid 100% by MCAG, but that's certainly your prerogative. That I don't need glasses, so I don't have a vision plan, but my child does. So, so that's how that would work. And it would show you exactly if you want to buy up, what your per pay period cost will be to buy up to the richer plan, if that's the way you want to go.
Thank you.
You're welcome. Then we have the life and disability plans. There's no changes for the next year again. These are plans that are paid 100% by MCAG as well for their employees. They do offer $50,000 in life insurance for each employee. And if you should die or be dismembered in an accident, if you die in an accident, then they double that $50,000 to $100,000 death benefit payout. Or if you should be dismembered in an accident, depending on the level of dismemberment, was it an eye, a hand, a leg, each, a finger certainly would pay less than losing an eye in an accident, but there are certain levels. So if anyone's in any kind of accident, not necessarily work related, you're out on the ranch or something and you lose a tip off your finger or something, then you can turn that medical claim in and get some payout for losing a tip of your finger or whatever that situation may be. You also have voluntary life, and that allows you to purchase additional life insurance if you want it for yourself and or your dependents. Each employee has the option on the voluntary life to select a $25,000 benefit, $50,000, $75,000, or $100,000 benefit. And the child is $10,000, and then you have different levels for the spouse as well. So at open enrollment time, say you already have $50,000 in your voluntary life insurance benefit for yourself, for the employee. You want to bump that up to $75,000 starting January. You can do that without any underwriting. So you don't have to fill out any medical history claim forms, anything else. You can go up one increment for the next year. But if you're at $50,000 right now on your voluntary life and you want to jump up to $100,000 for January, then you'll need to pull off the evidence of insurability form for Lincoln and fill that out. We'll submit that in, and then Lincoln decides, okay, we'll let you jump to 100,000. If they deny that based on your medical history or family history, and they say, no, we're not going to cover you that high, you still maintain that 50,000. So you don't lose everything. It would still just go back to wherever you were at, or you would have that choice to bump up to the 75,000 without any medical underwriting. Short-term disability, you have that available as well. It covers your disability benefits from 8 days unable to work. Once you're off 8 days, that benefit starts and covers you up to 90 days. It will pay up to 60% of your salary, up to $1,846 a week. So 60% of your weekly salary up to that $1,846. Again, it pays for 13 weeks, which is right about 90 days after the 8th, starting on the 8th day that you've been unable to work. After that point, if you're still unable to return to work, then they do have the long-term disability, and that long-term disability will cover you after that 13 weeks, up to 60% of your income, not to exceed $8,000 per month. So there is a benefit if you're disabled and unable to return to work for a certain amount of time there as well. So you want to make sure that you get those papers filled out. And I know Christina's really great too, if someone's off on leave of absence and she's getting all that stuff out there. But any of these things that you need help with as well, we're here for you. Jessica's here generally 8 to 5. I'm here a lot of times in the office or out and about, but we're here for you. If for some reason you call the office and one of us aren't here, then we have another staff member in our department that can assist you as well. They have access to everything as well. One of the big changes this year is your voluntary plans. You all have had AFLAC for quite a few years, and there's quite a few people that are enrolled on different types of AFLAC programs. This is a voluntary program, so you're paying 100% of that premium, but it's run through the group right now, so you're able to pull that premium out of your paycheck per pay period. We're going to replace AFLAC with Colonial Life, and there's a couple of reasons for that. Number one, pretty much everything Colonial Life costs a little bit less than AFLAC, and a lot of their benefits pay out better than AFLAC, especially like your critical illness, if you're ill, or if you have cancer policy. A lot of those policies with AFLAC or Colonial will cover you go in for your annual exam, you go in for a mammogram. Colonial will pay you quite a bit more as long as you submit that claim into Colonial. So all of their plans and their rates and everything will be loaded onto your ease program. We'll also have a phone number there. If you want to contact Colonial, they can explain those plans best to you. We'll have a rep out at the waste management sites that first week in December as well. But if you ever want to Zoom or have a phone call or meet one-on-one with a Colonial rep to kind of talk about those plans, then they'd be more than happy to come and meet with you or talk to you over the phone or a Zoom meeting, however what works best for you guys too. So those options will be replacing Aflac. On that note, once we cancel Aflac, which would run till the end of December, you'll receive something in the mail as long as Aflac has your current address. You'll receive a notice saying that the group plan is canceled. However, if you want to maintain on an individual basis your Aflac plans, you may do so on an individual basis, and they will bill you monthly at your home. So the cost doesn't change of what you've been paying, but instead of it coming out of your paycheck, now you'll be just mailing in a bill to Aflac. If you don't want to maintain Aflac, then you don't have to answer them at all, and your plan will just terminate at the end of December. And then if you've picked up any of those voluntary plans through Colonial Life, then those will start coming out of your pay as well. So voluntary benefits help pay. If I was in a hospital, you guys don't have a high deductibles on your plan or anything, but it can help offset some of those costs. Cancer treatments, certainly any type of wellness that you do with your provider during the year, get those receipts in. I'm probably one of the worst offenders when I had Aflac, that I had 4 kids that played sports, and we were in the emergency room a few times and we had Aflac and I never turned in the receipts. So get them in or send them to us and we'll get them in for you. Usually if it's a few years out, the carrier will go back and go ahead and still reimburse you for that. But somebody have a question? I see a hand up.
Me again.
Okay.
Regarding, I think I have Aflac, and there's just a lot of comfort level with the familiar name. Can you give any kind of comparison as to Colonial? I mean, I hear you with respect to they're better with respect to it being maybe richer and that they cost less, but I've had firsthand experience with Aflac, and everything went 100% perfect, especially after, having had a medical procedure. So I've gone through that before. And Colonial's just not familiar. That doesn't mean it's bad. It's just not familiar. And it's like, what's the assurance that they're just as good? So sometimes you can get something that's better and it's less expensive and you get more, but who are they as a company?
Right. Okay. So they're a very large nationwide company and they've been doing this probably as long as Aflac. We ran into a few issues that maybe Alicia didn't happened to you, but we ran into a few issues with Aflac as well over the last few years that just weren't being straightened out timely and things. And so it just seemed to be time to look at other options. Colonial Life doesn't have a duck, but I can guarantee you their service, you can put in a claim online and their payout is almost immediate within a few days generally, unless there's something weird and they have weird questions, then they're already paying out those claims based on the benefit level that you have. And there's all kinds of options, but I can understand you see Aflac on TV a lot, probably not as much as Colonial Life, but they're both A+ rated, which is important to us because we only want to bring in the top companies. The worst thing I could ever do for you as an insurance agent is to bring something in to save a couple of dollars. That's just going to cause you headaches and nightmares. I don't want that for you, and I don't want that for my team either, because they get to clean all that up. So you can look them up, but Colonial Life has been around a long time. They do major life insurance and things too, but they've done these voluntary benefits for a long time. So I hope that feels better. But if you're comfortable with Aflac, you can get billed at home and maintain your Aflac policies. You don't have to switch. That's up to you. It's just that little more inconvenience of paying that bill every month. And then the last thing is your flex spending plans. So this same like you have now. So you have your flex spending plan that you can put money into each January. For 2022, the amount's going to increase $100. So a employee could actually put in up to $2,850 of pre-tax dollars into a flex spending account that if you say, I want to use that full amount for 2022, then it'll split up between your pay periods and it'll take out a deduction each paycheck to equal that $2,850 for the year. If you say, hey, I don't think my expenses are going to be that much next year. I know I got some dental work. I know I have these prescriptions I have to pay for every month, or I do 3 months at a time of the mail order. I know what those costs are. I'm only going to put in $1,000 this year. That's your choice. On a flex spending plan, it is a calendar year benefit, January till the end of December, and it is a use it or lose it. So if you put too much money in there, say you put in $2,850 and you only use $2,000 that year, you could potentially lose that other $850. So we want to encourage you to go get another pair of glasses or go on. There's an online store where through the program that handles your flex spending plans, online store where you can go purchase items. We want you to use up that money instead of just letting it go back to the administrator. You also have your plan set up that if you still have a balance at the end of December, you actually can carry over $500 for the next 3 months into the following plan year. So you do have that extra little benefit there to use up to $500 that way. But it's always good to sit down and think about, what are my medical expenses now? Or what are my dental expenses? I know I need 2 crowns next year, or my child's going to get braces. Or what's that going to cost? The more you can put into those pre-tax accounts for services that you're going to be paying for anyway, that's benefiting you because now you're paying lower taxes on your income. And so those medical, dental, or vision expenses are costing you less out of your pocket because you're not paying tax on those dollars. And then on the medical flex spending account, again, you can use that for medical, dental, or vision expenses. So if you have extra money in there, go get an extra pair of sunglasses before you break the other ones or something. There's ways to use that up. And we can help you find those ways if you're getting towards the end of the year, or even if you have that 500 to roll over, how can you use those dollars up before the end of March the following year? But say you're putting in $2,000 into that flex health account. That $2,000 as of January 1st will automatically be loaded into your account. So on day one, January 1st, if you end up in the hospital and or the emergency room and you're going to pay $2,000 for that, that $2,000 is already sitting in your account. Once you use that up, you can't add more to it because you've already decided how much you want in that account for the calendar year. But you've been able to use that benefit. It doesn't keep adding paycheck after paycheck. Versus the dependent daycare spending account, you can put up to $5,000 for the calendar year 2022. However, it does not accumulate all at the beginning. It will go pay period by pay period. So say you want to put $200 a paycheck into that dependent care spending account. You have to wait for that $200 to get in there, and then you can pay your daycare provider from that. And then the following 2 weeks, wait for the next $200 to get in there. That way you're paying that daycare provider pre-tax dollars again by lowering your taxable income. So that's always a good thing. And I think that's it. Seems like we went a little quicker today. If anybody has any more questions, and don't forget, we want to make sure you make the best decision for you. So at any time, once you go into your portal, when it's all open, please give us a call and we'll help you. Or if you have coverage available through your spouse's work or something and you want to compare, is it worth us being on this plan or that plan? Or is it worth me paying that $200 surcharge for my wife to be on my plan versus on her own employer's plan? We'd be more than happy to help you out with that to help you make that best decision for you, because you're going to have that for the next 12 months. And then we'll get to go through all of this over again. And maybe next year I get to see you again. That would be even better.
Okay,
No
I think if
question.
nobody has any questions, that'll end this for the day. But again, I refer you back to that 1-page document that you received by email, just to go back and kind of refresh the highlights that Kim went over, as well as the website for the online portal that you have access to all year. So you don't have to wait until the 29th to go look at anything. You can actually go check on your profile and make sure all of that's up to date ahead of time if you'd like. But the 29th will be the start date of open enrollment. So you can start making changes to plans when everything's up and running. But you can always look at your current benefits now. You can always update your personal information now, make sure all that's accurate. And that you aren't waiting until the 29th. If you don't remember your password and all that kind of good stuff, you can get all that ironed out ahead of time. So
Okay.
I refer you back to that
Good thought.
document and make sure you have that handy.
Okay. Thank you.
All right.
Okay. Enjoy the rest of your day.